A 5-day training on HIV/AIDS for health workers across the country, sponsored by the U.S. government, was climaxed with a press conference to update journalists on status of the fight against the disease and the triple 95% goal, which is to be achieved by 2030. Public health analyst for Health Resources and Services Administration, George Tidwell, says 76,000 out of the estimated 80,000 people living with HIV in Sierra Leone need to be diagnosed to achieve the first 95%, and that 72,200 need to enroll for treatment to achieve the second 95%.
And then of those 72,200, we want to achieve viral suppression to reach the third 95. And that will require 68,590. So in 2020, on the first 90, we had reached 48% of the 80,000. So 38,400 were identified and diagnosed with HIV. So that's 48%. And of that 48%, 34,400 were enrolled in treatment, which translates to almost 90%. And then in 2021, it jumped from 38,000 to 51,000. And the number on treatment jumped from 34,000 to 46,000. That was a 22% increase.
Before the press conference, the U.S. ambassador to Sierra Leone, David Reimer, in his closing courtesy, unveiled that because of the progress Sierra Leone is making towards epidemic control, the U.S. government is set to support 15 new facilities in 4 districts across the country to enhance HIV/AIDS transmission prevention and response.
This training and the site-level support that will follow will enable you to improve the services and outcomes in your communities and contribute to the rapidly improving national HIV response. And to encourage you as you embark on a journey which has had outstanding results for the 15 sites which started this journey a year ago. I'm very proud of what our 2 countries, the United States and Sierra Leone, are accomplishing together. And I'm proud of you for committing yourselves to serving your communities with high-quality care and support.
In 2020, 48% of the estimated 80,000 people living with HIV in Sierra Leone was diagnosed. Country Program Manager for JPEGO, Bendu Agatha Kosia, explained that the training was on HIV prevention care and treatment for a total of 81 health workers, and that the 5-day exercise was done in 3 areas.
Freetown, Toloco, and Cambia, with a total of 81 healthcare workers comprising nurses, community health officers, pharmacy staff, and expert clients. There are 46 participants in this center from 8 health facilities in Western area, urban and rural districts.
Because the spread is believed to be active, the number of HIV infections is expected to be higher next year. However, the project might need a strategic risk communication structure where the media would be actively involved in order to prevent more transmissions. Salif Jorna Kamara, reporting for AYV News in Freetown.